Welcome back to Medicine Made Easy with me, Kavya. Now we'll be discussing and continuing our topic on RMNCH+A. This is part 2. The part 1 video link is in the description. You can check it out if you have not watched. And in this video, we'll be discussing a very important point as far as RMNCH+A program is concerned, that is 5 into 5 matrix. Before that, if you have not subscribed to the channel, to subscribe for more interesting videos like this, and as well press the bell icon so that you will receive regular video notification. And as well, I have made this video with simple diagrams so that we'll all remember more easier. This is an important essay question, and that's why this is given high priority. So you can share this video to your friends. We'll all learn together. Without further delay, let us start our discussion. RMNCH+A has 5 pillars or 5 thematic areas which we have already seen in previous video, that is reproductive health, maternal health, neonatal health, child health, and adolescent health. So the ultimate aim is actually to end the preventable child death. So as to end the preventable child death, we need to have some proper intervention, and that is the high impact targeted intervention. And yes, these interventions are what we are going to learn now. First is reproductive health. To remember it, I made it like a story. Let's simply remember like this. We know that 15 to 44 years or till 49 years is the reproductive age group of a female. Now, there was one woman who is at 26 years getting married, and she is running her life. She has children and she completes her family, and now she's at 46 years. Okay, so this is all about the reproductive life of these women. Now, what are all the strategies, high impact interventions we can do? One, after marriage, she may become pregnant. So she should know that pregnancy status, that is, she can use the pregnancy testing kit. She has to get access of that, that is niche care. Next is, there should be a comprehensive abortion care too. Next, after that pregnancy, there should be a postpartum IUCD, which is advised to the patient. Then, or the interval IUCD. Okay, interval IUCD at subcenter at fixed days, it can be given. Next is the quality sterilization service. And apart from that, all of these, there can be a home delivery of IUCD, and effective spacing methods are ensured by the ASHA worker. This is all about the 5 important strategies in reproductive health, that is PTK access, comprehensive abortion care, postpartum IUCD, interval IUCD, quality sterilization service, and home delivery of IUCD, effective spacing measures. Done. Let us now proceed to maternal health. So maternal health, basically there's a woman who's going to get pregnant and she's going to come to the hospital, and after that she will be taken care of by the ASHA worker. Now from there, she's pregnant. Her pregnancy may be a normal pregnancy or it may be a high risk pregnancy, and she may be delivering with or without complication, we don't know. Now, having this in mind, let us see where all the intervention we can do. First, now she is coming to hospital, so she'll be registered. So after registration, and she'll be given a maternal child tracking system. She'll be given a card, and through that she'll be monitored for her full antenatal care is done. In that card actually has details about this woman, her vaccination, and her height, weight, BMI, and so on, weight gain, and so on. The first is MCTS. Number 2, she may be a high-risk pregnancy. So identifying the high-risk pregnancy and appropriate management of high-risk pregnancy, especially the anemia, should be mentioned. And next is yes, equitable access to emergency obstetric care via the first referral unit. So supposing if she is in high-risk pregnancy or any even that complicates this pregnancy, there should be an equitable access to the emergency obstetric care via the first referral unit. And apart from that, if by chance that woman dies or even the child dies, what happens is we need to review the maternal, child, and infant death for corrective measures. And apart from that, a woman where a village wherein there are more home deliveries, in that time the misoprostol tablets are given to the pregnant woman at 8th month of pregnancy, and she has to conceive at the 3rd stage of labor. This is all given by the ASHA worker, and there should be an in-situ ASHA for home deliveries also. So what are all the High impact intervention, one is MCTS, high risk pregnancy identifying and management, equitable access to emergency obstetric care via first referral unit, review of the deaths for the corrective measures, then issuing misoprostol and incentive ASHA for home deliveries. Now we'll proceed to newborn. Now the baby is born. The baby may be normal or it may be a sick baby. So, and then after all the procedures is done in the hospital and checking the health status of the both mother and baby, they sent to the home. Now, this is the outline. As soon as the baby is born, we know a breastfeeding is very, very important. So exclusive breastfeeding should be done and breastfeeding should be initiated. This is number one. Number two, there should be a newborn resuscitation service and essential newborn care in the delivery point. Next, there should be a special newborn care unit, a NICU care in the delivery point level. Next is in home. Now baby is taken to home, right? So there should be an ASHA or ANM who is going to come to the home for a home-based newborn care. And then there can be a practice of community level issuing of gentamicin. So this is all about the high impact intervention in newborn health, exclusive breastfeeding and initiation of breastfeeding, newborn resuscitation center service and essential newborn care in DP, special newborn care unit and home-based newborn care, community level gentamicin issuing. Let us now move on to child health. Now, what is child health? Now, child is born. Now, it is growing. For it to grow, what is needed? Nutrition is needed. And for when it is growing, see, it is very, very common disease is acute diarrheal disease and acute respiratory infection, right? And the time when child is growing, it can have disease deficiency defect or any developmental delays also. So having this in mind, let us see what are the impact interventions. Now, the child is growing now, there can be nutritional deficiencies also. For that, there can be complementary feeding and iron and folic acid supplementation can be given to the girl child. Next, we know the very, very, very important point, that is full immunization coverage should be done. For acute diarrheal disease, it can be managed with ORS and zinc. For acute respiratory disease, that is the pneumonia should be correctly managed. And apart from that, as I already said, the child can have disease, deficiency, defect or developmental delay. For that, there should be a screening, and the screening is done by RBSK program. So the 4 Ds which is in RBSK program is to screen for disease, deficiency, defect, that is birth defect and developmental delay. This is very, very important. RBSK screens for what? Now we have done with child health. Now at last we are coming to adolescent health. Now adolescent is the one they are going to grow, right? And they are more susceptible nowadays in this environment, right? So having that in mind, first there should be we should address the teenage pregnancy, and there should be an increased prevalence of contraception. Number 2, there should be a community-based service through the peer educator. Next, there should be an adolescent reproductive sexual health clinic strengthening. Now we know adolescent women will menstruate, so she should be given a good menstrual hygiene education relating to that, and as well she has to be promoted this about the menstrual hygiene. Apart from that, as she is menstruating, she'll be suffering from anemia. So for that, there should be an iron supplementation and weekly iron and folic acid supplementation should be done. So addressing teenage pregnancy, increasing prevalence of contraception, menstrual hygiene promotion, iron and folic acid supplementation. Next is community-based service through the peer educator, then ARSH clinic strengthening. This is all about the intervention strategies in adolescent health. So this is a very, very important video. Remember, this is very important in writing the essays. Hope I made my points clear. If you feel this video will surely benefit you, please share this video to your friends. We'll all learn together. We'll all meet in the next video. Till then, stay tuned. Bye-bye.